Have you ever noticed your little finger becoming numb? Or a tingling feeling in your ring finger? Maybe it happens while talking on the phone, driving, or even while sleeping. Most people ignore these symptoms, but they could be an early warning sign of a nerve being compressed. Today, you will discover why this happens, what cubital tunnel syndrome really is, and how to prevent permanent nerve damage. Let's begin. Welcome to MediLearn Hub, where we make medicine simple. Whether you are a medical student, a physiotherapy student, a nursing student, a healthcare professional, or simply curious about the human body, you are in the right place. If you enjoy clear medical explanations with simple animations, please subscribe to our channel. Now, let's explore the nerve behind your little finger. Inside your arm travels an important nerve called the ulnar nerve. It begins in your neck, travels through your shoulder, down your arm, passes behind your elbow, and continues into your hand, near the elbow. The nerve passes through a narrow tunnel called the cubital tunnel. This tunnel protects the nerve, but it is also a place where the nerve can become compressed. When pressure builds inside this tunnel, the ulnar nerve becomes irritated. This condition is called Cubital Tunnel Syndrome. The ulnar nerve provides feeling to your little finger and half of your ring finger. It also controls many of the small muscles inside your hand. These muscles help you grip objects, spread your fingers apart, and perform precise movements. When the nerve is compressed, the signals cannot travel normally. That is why you begin to feel tingling, numbness, pain, or weakness, especially in the little finger and ring finger. The earliest symptom is usually tingling. Many people notice numbness in the little finger and half of the ring finger at first. The symptoms may come and go. You may notice them while talking on the phone, holding a book, driving, or sleeping with your elbow bent. As the elbow stays bent for a long time, pressure inside the cubital tunnel increases. The ulnar nerve becomes irritated. Many people wake up at night because their hand feels numb. Straightening the elbow often makes the symptoms improve. This is one of the earliest warning signs of cubital tunnel syndrome. If the pressure continues, the symptoms become more frequent. Tingling may turn into constant numbness. You may notice weakness in your hand. Simple tasks become difficult. Opening a bottle, holding a cup, writing, or typing may no longer feel easy. Some people notice that they drop objects more often. In severe cases, the muscles between the fingers begin to shrink. This is called muscle wasting. If nerve compression continues for too long, some nerve damage may become permanent. That is why early treatment is so important. So, what causes cubital tunnel syndrome? The most common cause is keeping the elbow bent for long periods. Talking on the phone, sleeping with the elbow bent, or resting your elbow on a hard desk can all increase pressure on the ulnar nerve. Previous elbow injuries, bone spurs, arthritis, or swelling around the joint may also compress the nerve. Sometimes the nerve moves out of its normal position when the elbow bends. This repeated irritation can gradually damage the nerve over time. Many people confuse cubital tunnel syndrome with carpal tunnel syndrome, but they affect different nerves. Carpal tunnel syndrome compresses the median nerve at the wrist. It mainly affects the thumb, index finger, middle finger, and half of the ring finger. Cubital tunnel syndrome compresses the ulnar nerve at the elbow. It mainly affects the little finger and the other half of the ring finger. Knowing which fingers are numb is one of the most important clues for making the correct diagnosis. If your doctor suspects cubital tunnel syndrome, the first step is listening to your symptoms. They will ask which fingers feel numb, when the symptoms started, and what activities make them worse. Next, they will examine your elbow and hand. The doctor may gently tap over the ulnar nerve behind your elbow. If this causes tingling in the little finger, it may suggest irritation of the ulnar nerve. The doctor may also ask you to bend your elbow for several seconds. If this brings on numbness or tingling, cubital tunnel syndrome becomes more likely. Sometimes, a nerve conduction study is recommended. This test measures how fast electrical signals travel through the ulnar nerve. Slower signals can confirm nerve compression. The good news is, many people improve without surgery. The first step is avoiding activities that keep the elbow bent for long periods. Try not to rest your elbow on hard surfaces. A soft elbow pad may help protect the nerve during the day. Some people wear a lightweight splint at night. This keeps the elbow in a straighter position while sleeping. Gentle nerve gliding exercises may also be recommended by a healthcare professional. If symptoms continue or muscle weakness develops, surgery may be needed. The goal of surgery is to reduce pressure on the ulnar nerve, so the nerve can recover. You can lower your risk with a few simple habits. Avoid keeping your elbows bent for long periods. Take regular breaks if you work at a desk. Keep your wrists and elbows in a comfortable position while using a computer. Avoid leaning on your elbows while studying. Working or driving, stretch regularly, and pay attention to early warning signs. Small changes today can help protect your nerves for years to come. Let's quickly review what we learned today. Cubital tunnel syndrome happens when the ulnar nerve is compressed at the elbow. The most common symptoms are tingling, numbness, and weakness in the little finger, and half of the ring finger. Symptoms often become worse when the elbow stays bent for a long time. Early diagnosis and treatment can prevent permanent nerve damage. Stay healthy, and I will see you in the next video. If your symptoms continue, do not ignore them. Speak with a qualified healthcare professional. If you found this video helpful, please like this video, subscribe to MediLearn Hub, and share it with someone who might benefit. Thank you for watching. Stay curious, stay healthy, and I will see you in the next video.